This is Dr. Durgesh Bailoor with his health videos. Today we have two very special guests, Rohana Nair and Ravina Nair, who are speech therapists. And our today's topic of discussion would be, when should the children be brought to a speech therapist for their treatment?
Hello everyone, I am Rohana Nair. I am training in a Masters of Speech Therapy in Kasturba Medical College, Bailoor. I would like to extend my thanks to my faculty and my professors at my department. I would also like to specially thank our HOD, Dr. Ratish sir, for giving us the permission to host this educational video.
Hi guys, we are back with Rohana now, and she will tell us, Rohana, what is the scope of this specialty, and because we as in India, we are not very clear about what speech therapists actually do. Could you please enlighten us?
Yes, for sure. So, one myth that I would like to bust right now is what individuals think that speech therapists are only for children or only for child therapy. But that is completely wrong. I would kindly like to say that is wrong. I would like to tell you that speech therapists actually work with all the populations, from children to adolescents to adults to older adults. We deal with all of them. In the older adults, we are part of a stroke rehabilitation team. We also take place in dementia and Alzheimer's in helping them in rehabilitation. We also, as many of you all might have heard of Parkinsonism, we're also a part of the rehabilitation team for them. When it comes to adults, we definitely provide services when it comes to cancer rehabilitation post the surgery, especially for head and neck cancers. We also provide stuttering therapy or stammering therapy. In adolescents, very sadly, they're the most neglected population because of the lack of awareness. So in them, we can see impairments of hearing, or we can see learning disabilities. We help them in communicating through reading and writing rehabilitation as well. Children now are a completely whole different domain, and also one of the vast regions that we provide services to. So in children we see delay, speech and language delay, we see autism spectrum disorder, intellectual disability, hearing impairment, and many other disabilities where we provide our services to.
So Rohana, as I understood your explanation, do you feel that a speech therapist must be hired by the school authorities so that this will enhance early diagnosis of speech problems?
Definitely, doctor. The schools in the West have already started implementing where they have speech therapists from preschool, and it is definitely one of a wide range of practice where we provide therapy as well as early diagnosis and intervention in schools. And I would be really happy, and our field would be really effective if we were to start our practices in schools to be mandatory from preschool.
Now Rohana, I would like to know, at what age do children typically learn to speak words and sentences? Could you give us a ballpark figure of, like, in months and years when these actions occur?
Yes, doctor. So when children are developing, I would like to just say that all children are not the same. Everybody follows a different pattern of development. That being said, there is a normative range for children to fall within to be able to acquire certain words to be termed as a typically developing child. So words are classified, you can say, into two. So one could be non-meaningful words and one could be meaningful words. Non-meaningful words start right from 4 months, where the child is completely in an exploratory stage and trying to understand what is in its mouth. So ma ma ma, ba ba ba, something like that. So they may keep uttering something. Meaningful words step in somewhere around 9 to 12 months, where they look at you and they call you mama, or they look at the dad and they say dada. So that becomes a very meaningful stage, and they know that that person itself is the mom or the dad. After the acquisition of these words, when they acquire probably 2 or 3 words and they start combining these, that's when we can see sentences. And sentence development probably starts around 1.5 to 2 years of age, depending upon the environment of the child.
Rohana, you have told us so clearly about the babbling, the words and the sentences, and at ages at which these would typically take place. I have a question that comes to my mind is what are the factors that affect either early onset of the sound making to the delayed onset of speech and production of vocalizations?
Yes, thank you for bringing that up, doctor. It is very important to know that, as I mentioned earlier, every child is different, but this difference comes majorly from their environment. So the communicative quality at home is one thing as a speech therapist I would look into. Imagine a client who's staying in a nuclear family and both the parents are working and the child is not really engaged with people. That may cause a very slow development when compared to a child living in a nuclear family, but the mother and the father take turns to continuously engage the child in communicating with the child. So what I would like to put forth over here is the quality of the communication should be rich in content. So the child is able to pick that up and the vocabulary is hence developed in a nice way. Another thing that could really be, a factor of variation is the exposure to the number of languages spoken. So in case we come from India and from a very multicultural and multilingual heritage, so in that sense, we have a lot of languages spoken at home. Because of that, we may end up having 2 or 3 languages the child is exposed to. Because of the rich language and the probably little confusion from one language to the other, the child may take a little longer, but we don't class that or deem that as atypical. That would still fall within the typical ranges for a bilingual or a multilingual family. Another thing that I strongly impose and speech therapists strongly want to put forth out there to the public is exposure to gadgets. As deemed by the World Health Organization, before 2 years of age, the child must not be exposed to any gadgets of any sort. No TV, no phone, no tablet, nothing of that sort. And we would say that before 2 years, no screen time for any child because that affects the development, and that's probably a topic for another session, but that's what I would like to say.
But Rohana, here you mentioned so much about environment.
Right.
Do you feel that genetics also plays an important role in development of any of these problems?
Definitely, sir. Now, if an individual has a genetic syndrome or a condition, then that would definitely affect the typical development of the child.
Hello, welcome back, Ravina. This is Ravina, who is a twin sister of Rohana, who spoke to us earlier, and she is also a training speech therapist. And I would like to ask her, what kind of therapies do speech therapists typically do?
Thank you, doctor. As a speech language pathologist, we deal with any sort of communication impairments. The types of therapy that we give are speech therapy, language therapy, speech and language therapy, voice therapy, swallowing therapy, any cognitive communication disorder therapy, and we also provide auditory verbal therapy for children and individuals with hearing impairment.
No, I'm confused about one thing. Can the parents directly come to you, or should they bring a referral letter from somebody who is looking after their family? What is the best course?
Thank you for that question, doctor. As a parent, the minute you feel that your child is having any sort of communication impairment, you can directly come for a consultation with a speech language pathologist. If not, you can also come for a referral from a physician, a pediatrician, a psychologist, a psychiatrist, a prosthodontist, a maxillofacial surgeon, an ENT doctor, even an oncologist.
Wonderful. I feel that we still do not have this referral chains built up in speech therapy. So I feel that let the other doctors who see this video also learn that speech therapists are one of the team members in management of such patients.
Yes.
So Ravina, I was really happy to know about the referral chain of how the child comes to a speech therapist. A very important query came in my mind that don't you think that the school teachers play a very pivotal role in the recognition or early recognition of these problems as they occur in the children, maybe preschool, school, and even adolescents?
That's an excellent question, Doctor. Yes, teachers do play a vital role in identifying communication problems in children and even in adolescents. This is because teacher spends most of the day with the child and looks into the child's reading and writing abilities, the behaviors and the communication patterns with all the other students even in the school.
Now I just wonder from your question, from your answer, that don't you think that the speech therapist must develop special awareness programs for the school teachers? And maybe your university, maybe your college can take some first step towards calling in the teachers of our district and creating a higher level awareness. So this will improve the referrals to you.
That's a wonderful idea, sir. This is most likely the future of our field in going into creating an awareness amongst the teachers.
So, Ravina, you have so aptly told us about the various aspects of therapies that a speech therapy professional is able to deliver. Now, I want, for sake of the parents out there, kindly summarize for us the do's and the don'ts by which we can enhance the quality of communication of the child.
Yes. Parents are the primary influencers of the child, and there are certain things that you can do. Whether you spend 6 hours in a day with the child or just 1 hour in a day with the child, make sure that that 1 hour is filled with quality communication and good content. What you can do is read stories to the child, narrate some experiences to the child like our grandmothers would do. You can get down to the child's level and play with the child. You can sing songs to the child. Now some parents may have some questions and ask, can I really give my toddler a book? Yes, of course, you can introduce text at as early as a few months even to a child, and that is very effective in the development of communication for the child. Certain things that you must not do is, don't isolate the child. The child is not meant to stay alone. We often see that parents provide gadgets or electronic gadgets as a bribe to eat food or for the child to obey them. Let me tell you one thing. The child will not develop the habit unless you introduce it. So do not give gadgets to the child as a bribe or as a time pass. Instead, engage them in storytelling and just quality communication. Finally, don't panic. There is help at hand.
Ravina, thank you so much. You have been so lucid and you have been so clear in your explanations. I'm sure that parents and teachers will now have a clear idea of what speech therapists can do for the child and the important role both the parents and teachers play in bringing that child to you when in trouble and the kind of help that is at hand. I am very confident that this will increase the awareness in our Indian society about the professional competence of speech therapists in India. Thank you so much.